Hey, I'm Dr. Upendra Kumar, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today we will discuss about the postmenopausal women having urinary problems. Most of the postmenopausal women usually they have estrogen deficiency, that is the hormonal deficiency, because of which the genitalia as well as urinary tract, it becomes very much dry, atrophic. So that leads to the natural mechanism of protection to the urinary tract. Thereby the urinary tract sometimes becomes lax or it becomes thinned out, and the muscles also become very weak. So that leads to various problems, like number one, frequent urinary tract infections. Number two, they can have, because of the muscle weakness, pelvic floor muscle weakness, they can have stress incontinence, or they sometimes have overactive bladder where there is increased frequency of urination and urinary leak. So these are some of the problems which can occur. Apart from that, infections can spread to the kidneys and lead to pyelonephritis, and the most important thing is stress urinary leak, that is because of pelvic floor muscles weakness. So all these things are a part of postmenopausal women. This is because of reduced estrogen free hormones. So what are the symptoms you face in this? Generally these women have frequent passage of urine. They can't hold the urine. There can be sometimes burning sensation. They can have bleeding from the urinary tract. They can have difficulty in passing urine. So these are some of the things, and there can be a lower abdominal pain or back pain, and sometimes they can have high grade fever with chills. These are some of the symptoms which suggest that these women are started having infections. And other important thing is they can have constipation, which can also lead to this type of urinary tract infections. So old women should always make sure that they do not have constipation by taking high fiber diet and high fluid intake, at least 2 to 3 liters per day. And coming to the bladder problems, they do have overactive bladder. That means the bladder capacity goes down, it becomes more irritable, and that leads to frequent urination, urgency, and nighttime frequent urination, disturbing their sleep. Sometimes even urinary leakage can be a problem with these patients. So that is one important thing. Apart from this, the third important thing is urinary leakage can occur because of the lax pelvic floor muscles, which can lead to stress urinary incontinence. That means when a patient coughs or laughs, or when he gets up while sitting, he gets up, or when he strains, there is a large urine leakage into the clothes. So this is called stress urinary incontinence. They can have both mixed stress and overactive bladder also mixed. So this is one condition which can be very troublesome because it's a social problem. They do not have any advantage of this. So this has to be managed very strictly. So what is to be done is, number one, we have to confirm this by doing a urodynamic study where there is no overactive bladder, which has to be ruled out, and it has to be a pure stress urinary incontinence, wherein we have initially Kegel exercises, that is pelvic floor exercises are done, which can usually improve this stress urinary leak, and overactive bladder can be improved by Kegel exercises as well as by giving some anti-bladder suppressants so that they don't allow the bladder to contract frequently. So apart from this, if the patient doesn't recover, so then we have to go for the sling procedures. It could be TVT or TOT. It's also called transobturated tape or transvaginal tape. So these two are done depending on the patient's convenience, and this would definitely prevent the urinary leak in a lot of women who would have had earlier prolonged labors or etc., where the pelvic muscles become very weak. So this is one important thing. So any woman who doesn't respond to medication or pelvic exercises have to go for a surgery, which usually is very helpful and it stops the leakage. So these are some of the important things. So all the postmenopausal women, most of them who have this type of problems, need to be replaced by estrogen creams per vaginally, so that the estrogen is replaced, so that all these pelvic musculature become more tonic, and also the urinary tract also becomes more healthier, and the atrophy can be prevented. Thereby frequent urine infections and as I said, bladder problems like incontinence, stress incontinence can be prevented. So all the elderly women need to get checked up for this vaginal atrophy or urovaginal atrophy, and they need to consult a urologist and take these proper supplements and do Kegel exercises, drink a lot of water, so that they don't have any problem to the kidneys. Otherwise, sometimes kidneys also can get affected and that can lead to kidney failure. Thank you.